Hello. Thank you for joining us at the Villages Healthcare. My name is Corey Goodwin, and I'm a licensed practical nurse and a nationally board certified health and wellness coach. In today's presentation, we will be reviewing the good and bad and the healthy and unhealthy when it comes to cholesterol. This presentation is designed for educational purposes only and is not intended as a substitute for advice from a healthcare professional. Presenters are not medical providers and will not diagnose or offer treatment suggestions. High cholesterol is one of the major controllable risk factors for coronary heart disease, heart attack, and stroke. If you have other risk factors such as smoking, high blood pressure, or diabetes and obesity, your risk increases even more. The more risk factors you have and the more severe they are, the higher your overall risk. There are currently greater than 90 million U.S. adults that have a total cholesterol level above 200 milligrams per deciliter. High cholesterol often has no symptoms, so many people don't know that their cholesterol levels are too high. A simple blood test can check your cholesterol levels. Having high blood cholesterol levels raises the risk for heart disease, which is the leading cause of death, and for stroke, the fifth leading cause of death. So what is cholesterol? Cholesterol is a waxy, fatty substance that occurs naturally in the body. Your body needs cholesterol to make hormones, bile acids, vitamin D, and other substances. Cholesterol circulates in the bloodstream but cannot travel by itself, so cholesterol travels in packages called lipoproteins, which have fat, a lipid, inside, and protein outside. Cholesterol comes from two sources, your liver and your diet. Your liver, other organs, and other cells in your body produce about 80% of the cholesterol in your blood. The remainder of the cholesterol in your body comes from animals, such as meat, poultry, and dairy products. These same foods are high in saturated and trans fats. The two kinds of cholesterol shown here, the HDL, otherwise known as the good cholesterol, carries cholesterol, triglycerides, and other fats away from the arteries back to the liver, where it is passed from the body. It makes up 1/4 to 1/3 of your blood cholesterol. High levels of HDL are protective against heart disease. LDL, considered the bad cholesterol. Now, while they do carry needed cholesterol to all parts of the body, too much LDL in the system can lead to coronary artery disease due to the buildup of LDL deposits in the artery walls. It makes up the majority of the body's cholesterol, including blood supply to your heart and brain. Having high levels of LDL can lead to a buildup in the arteries, as you can see from the image below. Triglycerides are a type of fat that is packed with cholesterol when the lipoproteins form in the liver cells. Triglycerides are stored in fat all over the body and can be an energy source like carbohydrates. Your cholesterol scores will show a measurement for triglycerides. A score higher than normal may mean you have a higher chance of developing coronary artery disease. Diabetes, obesity, kidney failure, and/or alcoholism can lead to high cholesterol. Excess sugar intake, especially from processed foods, higher saturated fat intake, can also contribute, as well as some medications. Arteriosclerosis is also called hardening of the arteries. It is the buildup of fatty substances in the artery which can lead to heart disease and stroke. It's a slow, complex disease that typically starts in childhood and progresses with age. Deposits of fatty substances cholesterol, cellular waste product, calcium, and other substances build up in the inner lining on an artery. They cause the formation of blood clots that can block blood flow or break off and travel to another part of the body. If too much bad cholesterol is circulating in your blood, it can build up inside the arteries that feed your heart and brain. If the cholesterol buildup gets too thick, it can trap blood clots in your arteries and lead to a heart attack or stroke. It's important to check your cholesterol to make sure you're at a healthy level. And healthy lifestyle habits like eating a healthy and balanced diet, moving your body, and eliminating risky substances can all help you better manage your cholesterol levels. Speak with your healthcare provider to see what an optimal level looks like for you. Aim for a balanced diet. Stay away from fad diets or diets that have very high or very low amounts of fats or carbs. If your healthcare provider told you that your LDL cholesterols are too high, pass up foods higher in saturated fats and trans fats. A heart-healthy diet will emphasize lots of fruits, vegetables, whole grains, and legumes. So it's important to know your fats, and that way it empowers you to know what foods you want to eat and what foods you may want to limit or just lose altogether. So from a dietary standpoint, the best way to lower your cholesterol is to reduce the saturated fat and trans fat. The American Heart Association recommends limiting saturated fat to 5 to 6% of daily calories and minimizing the amount of trans fats you eat. Reducing these fats means limiting your intake of red meat, dairy products made with whole milk, and it also means limiting fried food and cooking with oils like vegetable oil. A diet high in fiber can help lower cholesterol levels by as much as 10%. So this question comes up quite often. Does fiber really matter? Well, evidence shows that it can make a difference of up to 10% in making a difference in your total cholesterol as well as your LDL. It's found in a variety of fruits and vegetables, and that soluble fiber is the one that helps to lower your blood cholesterol. It dissolves in water to form a gel, which moves slowly through the intestines, grabbing up fat. So thinking about like the little Pac-Mans that go in and eat up all the fat, that's what the fiber will do for you. Dietary cholesterol, bile salts, and sugar are to be excreted. And once they are no longer available to build more cholesterol, this can really make a big difference. So women should aim for at least 25 grams of fiber and men to aim for 38 grams. And you want to gradually increase that and make sure you're getting enough water. What's important as eating a healthy diet is getting enough physical activity each week is a lifestyle change you would want to include. Add moderate to high intensity muscle strengthening activity such as resistance or weights on at least 2 days per week. Your goal should be spending less time sitting and being sure to get up and move throughout the day. Any activity is better than none. As with any type of exercise program, you do want to consult with your clinician. Be sure to have a list of questions ready for your provider and find out what the risks and benefits are in your own health and well-being related to your cholesterol levels. Thank you for joining us today. Please visit the Villages Health Learning Center to see about the additional classes, programs, and seminars we offer. A variety of sources were utilized in this presentation that came from evidence-based resources, including the American Heart Association, Cleveland Clinic, Mayo, CDC, and World Health Organization. Your feedback is very important to us. Please scan the QR code with your cell phone and complete the presentation evaluation on your phone. Thanks so much.